The following podcast is not relating to my teachings and work at Del Cedar Medical Center and is for entertainment purposes only.
Hello, everybody. Welcome to another episode of Life of Flow. We have an exciting episode today combining two of my favorite things, medicine and blockchain technology. Leah Houston, a physician, emergency physician, and also entrepreneur, leading a company that's helping us lead the way as we need to gain control back of our identity in medicine. And you'll understand way more once you tune in and stick with us through this very exciting topic. I know it was, for me, very eye-opening, and I think you learned a couple of things here there too.
I had no idea of some of the things she was talking about.
Very
so
cool.
This was very eye-opening.
Cool.
Yeah.
And also a call to action by the end of the show. Hopefully you'll understand what it is and follow her and download the app and join that community, because we certainly need to build ourselves up digitally. Thank you very much, and follow up. Two vascular surgeons walk into a bar and come out with a podcast. We are talking everything vascular and not. Welcome to the Life of Flow podcast.
Are you avoiding showing your legs because of varicose veins? Worry no more. At Hope Vascular and Podiatry, we have the solution. Our vascular specialists are ready to rid you of those pesky varicose veins. Regain your confidence and enjoy life without complexes. Call 346-400-4673 or visit our website at www.hcic.io. Because at Hope Vascular and Podiatry, the new normal is you better.
Leah, it's great to have you here. You and I go back a while. We've had a few conversations about business, specifically about the business that you're leading. And I think that the people that follow this podcast would be very interested in understanding what that means. And I'm not going to even try to butcher your project, because it certainly requires a depth of knowledge in computer sciences that maybe I don't have, or Lucas doesn't have either. And so maybe, I guess the best way to set the stage is, what were you doing before this? We know you're a physician. What were you doing with your professional life? And how did you come to this kind of aha moment that, you know what, I'm going to drop clinical, or I don't know if you still do or not, and maybe dedicate myself to trying to put together a project that has a different kind of relevance in my life.
Yeah, so I'm an emergency doc. Yeah, well, thank you. Thank you so much for having me on. I'm really excited this is actually the first time I've done this in a little while, so it's good to be back. So I'm an emergency physician. Practiced across the U.S. for 10 years in emergency departments, from, super inner city, San Francisco, New York City, to, more rural and cushy places like the Hamptons and Yosemite and Santa Rosa and Miami. So I saw kind of everything, and I worked as a locums doctor. So I credentialed for all these different systems and kept up all these licenses. And just to kind of bring it back, I'm not somebody who just had an idea and jumped into it. I had been exposed to this technology before because, as we want to retire, we want to make good investments. So I'm a real estate investor. I invested in my early 20s. I invested early in, some of the other things. And I learned about Bitcoin in 2012. And
look at you.
Well, I didn't buy any then. Dumb. But I did a few years later. But as we do when we're curious about something, when something interests us, we read a lot, we learn about it. And everybody was like, we're going to put patient health records on blockchain. I'm like, well, how is that actually going to work? I want to hear the mechanism. I want to see the process. And nobody had a real answer. So I'm like, okay, whatever. And I slowly followed all these projects. And I thought about it and I said, there's this thing called decentralized identity. And if you layer in decentralized identity, then the patients can identify themselves and then maybe it will work. But it was like a superficial conversation that I was having with people. And then one day I learned that a hospital that I was previously working for, after I left the hospital, after I left the state, after my license had lapsed in that state, I learned that a hospital was billing for patient care under my professional identity that I never rendered. So they were committing Medicare and Medicaid fraud under my license, under my professional brand. And it was my fault, according to the system. I had to prove that I was actually working in another hospital on the same days in another state in order to prove that I wasn't working without a license to the federal government. And during that time, I came to this realization like, oh my God, it's not just that patients need to own their data. We as doctors need to own our data. We need to own our credentials, our right to bill under our name. We need to understand what's being billed under our name. We need to be able to authenticate proof about who we are. And it can help with the friction of credentialing if we build these tools. And so, I dug into the community and I said, hey, is this a real solution to this problem? Does this technology actually solve this? And then I looked at the regulatory requirements, which is very interesting. The reason that I was the one that was in trouble when this happened is because legally I'm the only one that can control my credentials. But as all the doctors who are listening to this podcast know, we are essentially forced to give away our sign-in rights and our login rights to many credentialers, to the CAQH profile and et cetera, et cetera.
Yep.
Because we don't have the time and they're trying to make it easy, but that's illegal. That's illegal. And it puts us in danger. So for those of you who want to know if anybody's being billed under your name, you can go to the PECOS website, PECOS. But that's where I got the idea for the company.
That's super interesting. Just side note, how'd that resolve itself?
It was a 5-month legal battle that was extremely stressful because I was still paying my $360,000 medical school loans and for an apartment in a city. So it financially decimated me, but I did win a small settlement agreement with the hospital. But after not working and dealing with it for 5 months, it wasn't even nearly close to what I really deserved, in my opinion.
So in what point in this process do you come to the realization that you want to frame this on a decentralized, system? And why not just a regular database like any other, highly, quote, secretive industry like banking, for example? We still bank on databases encrypted, but not necessarily on blockchain technology.
But banks are adopting blockchain. Chase is now.
Yeah, I'm sure there is. I'm just curious why you had that moment that this totally makes sense, and how did you dive into the point that you were able to then even change this, not only to, hey, this is a good idea, but actually building a true company from this? Yeah,
so the regulatory requirements require that we have access management to information, whether it's patient information or credentialing information. And when you have centralized systems, you have to then provide a unique login to every single system and interact with all these different systems and have different passwords. Decentralized identity is the only solution that solves that problem, where you can have single sign-on capabilities with a decentralized identifier, where you can keep your login information in a secure enclave. And essentially, the people that were solving this in the centralized database way are the ones that have created this mess.
Right.
So in order to not only respond to the regulatory requirements, but also to create user-centric experiences that are seamless and feel automated, you need decentralized identity in order to do that, in my opinion.
So walk me through how that would work and help us. So say tomorrow somebody offers me a great job. I said, yeah, let's go. And they said, I want you here in 2 months. No way that happens now, right? So how would that?
Well, let's make it, we need you tomorrow.
Okay.
Our entire department was on a ski trip and they got into a bus accident and they're all dead. We need you tomorrow and we need 5 other people. Like, let's just, it's a bad scenario. I don't want to wish that on anybody, but we're not talking about anybody specific. So if you have verifiable proof that you actually graduated from medical school, that you actually have a license, that you're boarded in whatever you need to be boarded in, that you're up to date on your CMEs, you're up to date on your DEA, and all the other things that are required, your procedure logs, you have verifiable data about that, verifiable credentials. Any quick letter of reference, you guys can quickly write and sign a letter of reference and push that credential into your wallet so that you can take that package and share it instantaneously and instantaneously verify and get to work tomorrow. That's the vision that we're building. That's the future that we're building. Now, right now, the infrastructure is just now starting to be built where APIs to this stuff is being accessible. So many people don't realize, but the American Board of Medical Specialties has like API access to your medical board certification data. CAQH has an API. The NPI, we use an API to hit the public database to just verify that you're a doctor for our application. So we verify you're a doctor and we verify your identity just to be able to enter the app. So this is a physician-only application. And then there's state licensing boards that have APIs that they're being developed. The state of California is one of the first ones to do it. So this instantaneous, automated, permanent, ongoing, every second of every day ability to verify and authenticate that you are licensed, credentialed is coming. Mm-hmm. The infrastructure is being built now. The standards are being built now. And we are, as a company, building tools to respond to it in a way that benefits us as doctors and makes our lives seamless and easy. Because all these centralized systems are going to incorporate these APIs, but they don't care about us and our user experience. They don't care. We're the only company that's fixing this from the physician perspective, that's building tools so that you can own your identity, your brand, and authentication in a decentralized way.
At what point do you decide that this is going to be turning into a reality and you want to be? I mean, was there other people? Is this a board of people? Is this just you? I mean, it's just a huge project, right? I mean, I'm now having questions about the multiple layers of programmers. Are you using OUS people? Like this is a huge undertaking. And then we'll get into that, but I'm interested also on the hurdles of regulatory processes that are going to be adopting this for you. I'm sure that's going to be another pain in the butt. But like, how do you get to the point? Like, who was behind this whole thing, and how did you start maybe even getting to the point where you started raising funds for this?
I want to respond briefly to the regulatory thing because people bring that up a lot. From a regulatory requirement, we have a lot of clout and a lot of ability. If you look at all the federal and state regulations, physicians have to have access to things. But because we don't have the capital resources to develop and build solutions that we can have in our private practices that give us that direct access, we've been increasingly employed by health systems, private practices dying, et cetera. The reason that this is happening is because of the technology advancements and the regulatory requirements that we just can't keep up with and also run our private practices. So that's another reason that I believe this is a really, really big game changer for us as independent doctors. It will provide us an opportunity to have independent practices again. But going back to the origin and how
can you dive a little more into that? So how would this empower doctors to see private practice as a more viable thing? Because it does seem daunting.
The company is called HPEC. It stands for Humanitarian Physicians Empowerment Community. We empower humanitarian physicians. So if you join our application, you are entered into specialty-specific groups based on your specialty, state-specific groups based on your state license, and then specific groups based on your medical school and residency and fellowships. So once you're in there, we have a social graph where you can connect with colleagues and say, hey, I refer patients to them. They refer patients to me. We work together clinically. We went to med school together. We build a foundational social graph under there where then when it's time, like, for example, I just tweeted about an hour ago about how this week everybody's contacting me. Hey, do you know where I can get a mammogram? Where can I go for an emergency visit and not wait 6 hours? And I'm not even practicing right now, right? And I'm still getting these messages. All of us are all the time. Our friends, our family are constantly asking us for advice. This type of system, it's really a DAO. It's a decentralized organization of physicians where we can find each other, ping each other, curbside consult each other, send patients to each other in a verified and identity verified way. So, we can essentially build our own referral networks outside of the medical industrial complex with this technology. Now, It's a big undertaking. You're right. So how the hell did I get here, and who's doing it with me? And am I just alone coding in the basement 24/7? No. I don't have a technology background, or I didn't until I started this. I did get a certification in AI from MIT recently, just to kind of like, get up to date on what the AI world is doing. But what first happened is, the second I was able to get back to work after my license was reinstated and my Medicare, Medicaid privileges were reinstated, I was like, I gotta get back to work. I gotta make money. And 3 months later, my mother gets leukemia. And so even though I thought about this idea, I just wanted to get back to work. I just wanted to replenish my funding, my financial situation. But so my mother gets leukemia. And then I just take some time. I scale back my shifts to half time. So I'm working 6 shifts a month. And then she falls with platelets of 0 at home. And I'm like, screw this. I'm taking some time off. So it wasn't like I'm quitting this medicine and I'm just going to go do a startup. No, it was like a combination of the fact that I stopped working to take care of my mom. And when you're sitting at somebody's bedside and they're sick, you have a lot of time. So I started essentially doing what now I'm realizing is customer research. And so I dug into the physician community. I said, hey, this happened to me. Has anybody else had this happen? There was an overwhelming response. That credentialing and identity is a pain point. And so I contacted also leaders of the identity community. And I said, hey, is this a use case? And I started really reading about what they're doing. And they said, oh my God, it's a huge use case. You should fly to the identity conference. So I flew there and I met them. I also contacted attorneys and regulatory people. And I said, hey, is this legal? Is this possible? And they said, actually, that is what the system really needs, but the technology isn't there yet. And so I got all of these signals from the potential physicians who are going to use the solution, from the people who are in the identity world and building these open standards, and from the legal and regulatory world. And so I said, well, let me go talk to some pitch people. And so I went to a pitch competition in New York City, and I met our attorney, who said, who's your attorney? And I said, well, you are. And he's been our attorney ever since. And he's a top securities attorney in New York City. And he's a brilliant guy who's really helped me and coached me through it. He's done startup law. And so we opened up the Delaware C Corp. And the same doctors who said, oh my God, yes, I want this, put in the initial around $150,000. And with that, we did the design for the application, and we built websites, and we, got all the legal stuff taken care of and opened up bank accounts, and then also applied for our first crowdfund with that capital. And a crowdfund is basically like a mini IPO where you get to sell stock to the public. And people don't realize it's very complex. It's very, very regulated. It's an SEC regulated thing. So we had to hire accountants and do forensic accounting and stuff like that. And so then we raised $500,000, and we used that to build the initial beta version of the application, which is currently available in the iOS and Google Play stores.
How do people find those apps?
HPEC. Yeah,
HPEC, right? HPEC.
Yep.
Mm-hmm.
Mm-hmm.
And to build an account is free, right?
It is free to join, and you have to be a physician to join. Yes.
Okay. How do you make sure my identity is mine? How does this identity system prove my own identity? We're using the most secure protocols that exist. We're using open standards identity systems. We are actually building this technology in the way that we're saying it. We're not just pulling you. And the fact of the matter is aside from your driver's license, which we do verify, and we use a third-party application that basically does facial recognition and does a picture of your passport or your ID. So it's like we hit the public API. Are you actually a doctor? We hit the CMS database. If they say yes, we let you in. We ask you for identity. And then once you verify your identity, then you're allowed access to the application. So every single doctor in there is a verified physician that has actually gone through at least 1 year of residency, because you have to do that to have an MPI. And we're, lots of discussions about global opportunities and stuff. But right now we're working in the US only because we need these tools to verify. Yeah. And then you get to, experience the beta version where you can hold, store, share, upload, keep your credentials. So you can keep pictures of your medical license. You can share them with whoever you want. You can receive digitally verifiable credentials, but nobody's doing that quite yet.
Actually, I don't want to say nobody. HCA, the huge health system, actually started implementing verifiable credentials for credentialing. And I just learned this a few months ago. So this is coming, It's just, are we going to lead the charge, or are we going to allow it to happen to us the way it has been, over the last 30 years?
So where did you farm your development to, if that's something that you want to share?
So the first person who helped design and develop the initial application, I met him through the Internet Identity Workshop in the decentralized identity community. I found a bunch of people who had done this before, and I said, hey, which one of you can do this for us too? I found him. And then I also found our front-end developer. His name is Raju. He is in Romania. I found him on Brain Trust, which, if you look at Brain Trust, it's a DAO of developers, and you get tokens when you hire people. So he helped to build those two together. For 6 months, we just sat and built. And now we have a co-founder, CTO. His name is John Guerin, who's full-time on the project. And we have another team of 3 other developers who are working with us to kind of optimize it and fix bugs and get it to market.
And have you gone past your crowd funding round? Are you raising a series of some sort, or where's the company's financial health right now, or not health, but where are you at?
We just closed another crowd fund.
Okay.
So we've raised from only doctors. And when I say that, there are non-physicians who found us on the crowdfund and invested. So it's not 100%, but 99% of the investors are physicians, because we want this to be owned by doctors, right?
So where do you go crowdfund? Is this like a site that's...
Yeah, crowdfunding.com.
Oh, is that the name of the website?
Well, there's a lot. So if you want to know about crowdfunding, there's a website. So FINRA is the SEC regulation site that regulates crowdfunds. So you can go to FINRA, and there's, probably 100 or so crowdfunding sites. So the first time we used one called Fundopolis. And this most recent time we used Start Engine, which is the leading crowdfunding platform. And so we've raised a little over $1 million in total.
So how do you see going to market with this? Who do you approach? Who's your client? So obviously doctors are your users. They might be your clients, but they might not be. Who's your client?
So we're building a marketplace, right? So right now the credential verifiers are paying. They're paying for software systems to manage credentials. They're paying, human resources to type in the system and to do the primary source verification. They're paying credential issuers. Like, people don't realize this, but the AMA charges a certain amount of money. I think it's like $45 per credential check. So they're selling our data. So the credential verifiers are already paying an average of $3,000 per doctor every other year to verify and maintain. And from a regulatory compliance perspective, they're required by law to do it every 2 years. And now a lot of us have heard about the No Surprises Act. So the No Surprises Act says, if you have health insurance and it says that this hospital takes your insurance, that hospital can't send you a bill. Even if the vascular surgeon that did your surgery isn't covered by your insurance, he's SOL. And so this is another reason why talent has been concentrated as in employment in hospitals, and there's private practices dying, because hospitals have facilities fees and hospitals have to essentially provide care. So they're given all these, different perks by the states and the governments to stay open. And, it's just hard for a doctor to be able to be found. I mean, you go on ZocDoc and you get a cesspool of God knows who, uncredentialed, who knows what, somebody will have a cold leg and they'll end up going to a chiropractor or something if they go to that website. So, we're going to be indexing and credentialing people so you actually know that they're competent. We could push this data to a publicly facing website. So even though our application is free, we are going to provide services to doctors if they choose to pay for public profiles, for single sign-on API access. If they want their own personal community, we can build that for them. But the real solution is around credentialing and identity management. And that would be access through an API that can be integrated into any currently existing system. So we're not a credentialing company. We don't want to build a credentialing solution. We don't want to build more software. The app is enough, but we can build a verifiable credential API that can push into any software system out there.
Is the company is privately held, right? By the people on the cap table right now?
Yep, it's a Delaware C Corp.
Okay. But you're not giving every single investor in the crowdfunding voting rights, right? I mean, you're
They
not
all have
using
voting rights.
How are you using a DAO for the actual decision making of the company and the direction of where you're taking it?
So before I answer that, I'm going to ask you, have you used any of the DAO tooling?
No, I have not. Mm-mm.
Okay. It's very friction filled and the gas fees are outrageous.
Okay.
And knowing doctors, I tested that market with wireframes and with user journeys. And I actually did do some interviews with doctors who have spent time on DAOs. Like there's a couple of doctor DAOs that were started.
Can we explain what a DAO is? I don't know if everybody knows.
Yeah.
Yeah, of course. Yeah. I think that Leah would be more please.
Yeah. So a DAO is a decentralized autonomous organization. Mm-hmm. Decentralized meaning no centralized control, no top-down governance. The individuals govern themselves. And so the way that the word DAO has been interpreted by the crypto community is one token equals one vote. And if you have X number of votes, maybe we'll implement some quadratic voting so that you don't have all the votes if you have all the tokens. But for anybody who interacts with cold storage wallets and with true DAOs, it's not easy. And doctors are busy. They just want to see their patients. They want to go home. They want to invest in stuff and make money. They want to make sure their practices aren't going to be shut down. They're not going to learn a new way of being just to be able to vote on whether or not we should implement this practice guideline into our hospital system, right? So decentralized identity can be used to vote. And that's why we focus more on a decentralized identity model rather than the true DAO, what's known to be DAO infrastructure that uses tokens and things like that. And we do have, some of those governance tools in the app already.
I mean, essentially you would have the ultimate digital democracy where all these people, which could be hundreds or thousands, are weighing in with their voting power to decide. But I have an issue with that because it sounds very it's almost like a dream, right? It sounds like a very utopic reality, but I don't know that doctors would be mindful enough to cast votes that will shape the direction of a private company appropriately so when they're distracted with all these other things. They don't have
I'm trying to grasp at what some of the things you're saying. So
no. So they don't use DAO. So though I believe that what I'm saying is that you are a firm believer of the power of DAO as a democratic tool. It doesn't necessarily make a ton of sense, especially for physicians and for this sort of program you're doing, right? Because I don't believe that. I would rather have a core competent group of people that are really, really knowledgeable and are directing this company, because potentially behind this is potentially an exit strategy, right? I mean, I think the people that are funding nothing. No. I mean, nobody. So people are putting money into this company that you're never going to sell.
IPO.
There you go. Well, that's a big deal. Like, you're going to give some money back to people if you IPO. I mean, I see this as an opportunity of investment too. No, it's an investment tool.
Oh, for sure. Yeah. I mean, this is going to be a freaking cash machine. People have no idea how much money flows. The system does. The insurance markets know. The vertically integrated systems know. That's why they try to own us. Because with the stroke of our pen, we decide if you're going to get an endograph or a bypass.
Yeah.
Whether you're going to be admitted or discharged, whether you're going to spend another day in the ICU or whether you're saved for the floor, whether you're going to get the $17,000 one-dose medicine or not, And so that's why they want to control us.
Yeah.
You struck such a chord because I think I've I think I've imploded in many ways, and now this is the moment of the pod where we use it for self-therapy. But I did corporate medicine, academic medicines, all these things, big academic facilities for so many years. And then one day I had a huge job, really, really good. And then I just decided to quit everything and start my own thing because I hate people and I hate systems. And I hated that all of a sudden I felt like we had lost all the control and the relevance in our professions. Yet we are the motor of the system. So there's there's this complex system that feeds off of us. And somehow we have become
a cog.
The most unintelligent group of people within our corporation, right? We've allowed this rhetoric that we can't lead, or we're too busy, or we're not smart for a C-suite position, or we don't understand money, or we can't, like Excel sheets. Like we've really been pushed into this dumbass rhetoric.
Yeah.
That we're so intelligent. Here's the thing that we're so smart and so good at what we do that you shouldn't even be bothered by looking at the numbers. And FYI, you're always underproducing.
Yeah.
Your RVOs suck.
Yeah.
And you should kiss our feet because your salary is amazing. You're part of the 1% of the world. And you just don't, poor little thing. You're so smart. Go ahead and do your smart things. And what you're saying is absolutely perfect, which is, we need to just move these suits away and get back in the driver's seats. I mean, by the way, I see the system. Like, I am suffering every minute of my life since I quit. I mean, I'm having, RCM issues, accrediting issues, credentialing issues, everything you can think of issues. So I went from, very high earning market to now, very, very poor, no salary for almost 9 months. And I'm still holding to it, and I'm very proud of it. But it just shows how the system is absolutely rigged to not allow physicians to succeed at being their own motors and being in control of their own destinies.
Well, where's
100%
our responsibility in that? Because
where is our responsibility? Everything.
No,
doing.
I agree. So how do
we were complicit.
Exactly.
So we're complicit. So a lot of what you're saying, it's a lot of new information for me. I have no education in what you're saying. And it's overwhelming. Just hearing, I was like, oh my God, what the fuck? Like, I was thinking, is somebody billing in my name? Do I need to get a lawsuit? So I don't even know how to educate myself about this. Like, how the hell do I even have a grasp of what's going on to be able to have an educated opinion? Right now I have no idea. Talking to you.
Well, best way to do it is sign up for our newsletter and read it. We don't send a lot of stuff out, and then join the app and, become a part of it. We learn by doing, see one, do one, teach one, and honestly, it's overwhelming for me. Every day I'm learning something new. I'm working 12-hour days. I don't sleep. I'm working more than I did when I was a medical student or a resident, and I'm still learning something new every day. And I'm like, oh my God, I need to, I feel like every second that I'm sleeping, I'm missing something that I'm supposed to be doing, But it's complex, and they've purposely made it complex. They've created a tremendous amount of administrative burden and complexity in the name of regulatory compliance, but that's led to so much friction that it's not even worth it to be a doctor anymore. Like, my medical license in Florida lapses next week. I'm never practicing. I take care of friends. Occasionally I'll write a note in my computer and write a prescription for an antibiotic or something, but I'm not actually practicing full time right now. But I've maintained my licenses, but I have to do 40 hours of CMEs uncompensated on top of paying this $400 and something, on top of signing this thing, another $700 for the, Florida birthright, whatever, neurological injury thing. And then, it's like, why? It's not worth it to be independent anymore because of the administrative burden. And so that's basically what we're solving. We're fixing this from the physician's perspective, creating the tooling to make credentialing easier, creating the tooling to make, creating coordinated referral networks easier so that you can send patients to where they belong, not just where your hospital system forces you to send them because they're on call that day. I mean, I'm sorry, but I used to work in systems where it's like, the guy who has really good outcomes and the guy who has not so good outcomes. And if the guy doesn't have very good outcomes is on the day that you have a really complex case, it's not ethical to refer the patient to that person. But we're required in our contract to do that. I actually know a doctor in California who had a very complex case, neurologic case, and they had a neurologist on call, but this wasn't the specialist that this patient needed. And she referred the patient out of the system. She was fired.
Wow.
And she not only was fired, but she was sued by the hospital for breach of contract. And even though she won that lawsuit, she was dragged through court and lost all her money and is now financially in a big bad place. That's one case. I hear these cases all day, every day. And this is about collusion to co-opt the doctor-patient relationship and collusion to make private practice disappear. And so we have this tool now that we're building to try to reverse that trend and get back to what we promised our patients we would do, is to serve them first.
When you look at the trends of privatized medicine, I want to say, what is it, 2024 now? In 10 years, we went from about 60 to 65% private physicians to, I think, under 50% now, somewhere around the 48 or 49%. You may have a more updated number.
And they're all the older guys who are retiring soon, who don't have the administrative burden because they've got their operations in place and they've kind of figured it out. Younger docs can't do it anymore. It's going to be gone in 1 or 2 generations.
Who is the most? Is it the hospitals? Are the hospitals our number one enemy here? Are they just taking advantage of this insult and administrative abomination and then just using that to target us and just suck us into the system and cog us?
I have very strong opinions about this, and I will share it. We're addicted to insurance. We, the patients, and we, the doctors. We are addicted to this product that doesn't provide any kind of value to most of us. It's a huge administrative burden for both doctors and patients to use your insurance, to understand it. But for some reason, we're addicted to this product and we're addicted to the networks that they've created. So I believe we are our own worst enemy. We need to start making decisions to optimize our own livelihoods and to optimize our patients' individual health, and to coordinate care with each other and to adopt solutions like HPEC that are truly designed and developed to serve us and our patients. Regarding is it the hospitals, I think that there's a huge, working on what I'm working on, I think healthcare is a nonpartisan issue. But, because we're doing something so revolutionary, I'm getting very, very liberal doctors who say, oh my God, it's all, corporations' fault and the corporate practice of medicine. And we just need to get rid of the corporate practice of medicine. And as soon as it goes away, everything will be great. And then I have the super conservative doctors who are like, oh my God, it's the government meddling with everything and creating all these onerous regulations and all this administrative burden. And if the government just went away and got out of the exam room, we'd be fine. And the truth is they're both right. They're both right.
Is it centralized power in whatever form it takes?
It's centralized colluding power between government, bureaucrats, and crony capitalists. It's corruption in our governments, it's cronyism in our capital markets, and it's backdoor lobbying, legal bribery that happens. EMRs, I was around before EMRs. High-Tech Act was finalized in 2009. Judy Faulkner, founder of, CEO of Epic, she put a ton of money into lobbying.
Wasn't she one of the most frequent visitors to the White House for a time period or something like that? I read that somewhere.
This is what I'm saying.
Yeah.
And I used to be an advocate. I used to lobby on Capitol Hill and for state government stuff. It's a lot of work to not only understand this legislation, to get on an airplane, to meet with these people, to shake their hands. And we're busy doctors and there's a shortage of us. That's why a DAO can help with this kind of thing. If we can kind of vote on these things and, publish our findings, you see these surveys online, but are they really doctors voting? We have an identity verified way of doing that. It's not fully developed yet. We're in the middle of developing it, but That's one of the things that we want to do. So yeah, in my opinion, it's cronyism and corruption in both the capital markets and the private sector and the government. And, it's up to us to hold these individuals accountable and to seek out the regulatory compliance, the regulatory rules that serve us and our patients, and enforce them and make sure that they're being enforced by our elected officials.
Yeah. I've actually, like, one of the most inspiring things that I've experienced recently as far as like the business of medicine was I have a outreach clinic in Burnett, Texas, which is like an hour away. And it's really nice. People are super nice, but I've, went and talked to some doctors there, and they're doing concierge medicine in this area. And this is not a very affluent area, but they came up with a business model, but their primary care and their OBGYNs and stuff like that. And I've always thought, is there a way for surgery? And I'm not smart enough to answer that question. There probably is. There's a solution to everything. But is there a solution for surgery to empower ourselves? Because I have a concierge physician here. I pay him an amount that's probably a little more than most people can pay. But, he gives me amazing service whenever I need it. In my opinion, it's very, very doable, but not without the referral network. Right? A person is probably only going to see you for surgery once in their lifetime if they ever need it, right? So you need a referral engine of people that trust you, that know you exist, number one, in order for that to work. And that's what HPEC is. And then from a revenue cycle management perspective, you're talking about you're having that friction. We need tooling in place that automates that process and makes it easier so that if a patient has insurance that you take, you're not doing any paperwork and you're not spending a lot of money on HR staff to do that paperwork. It happens in an automated way. And this is all coming. It's just, are we going to have access to these tools? Are they going to be designed with with us in mind? Or are we going to be left SOL like we have been in the past?
So when you and I are colleagues on the MIT front, not that I went to MIT, I'm not that smart, but I did an MIT course on blockchain. And I remember one of the things that is still like this unanswered thing is the what's the last mile? Meaning, when you're using, and that was specifically on like cryptocurrencies, is how do you go from this alternative payment model to it being a transactional process that you could do with an Uber driver, right? When can I order Taco Bell and pay him with 0.00001 Bitcoin, right? Then that's still going to be a significant problem that's going to need a lot of figuring out. And I guess that probably applies to your company also, which is, building the blockchain seems relatively straightforward. Outsourcing some of the programmatic things is straightforward. Getting physician, involvement is going to be moving a mountain, but it's doable. And you've shown that you.
I was going to say, don't say it's straightforward.
No. But you've shown that you are very, you've been very good at being able to sway and convince of this, very good cause. But then there's this point of, okay, if we do have this, and if I do put my credentialing system and I do put all these things, it is that actual conversion. And I think in a way is I think Lucas said, who's your client, is the last mile of this is how do you turn it into a practical tool, and how long between this dream of yours and the actual answering of the last mile are we from, in your opinion, and how difficult is it going to be to do that? Where I today move, you said HCA is taking it. FYI, I applied to privileges to HCA and I put in my privileges like a month and a half ago. I would love to just come and be like, hey, here's this thing. Boom. Yeah. Everything's there. Cause I'm an IMG. So I did medicine in Costa Rica. So I have an ECFMG, and this is my experience. I'll finish my monologue, promise. But I applied to this hospital that took 4 months to just get a letter from the University of Costa Rica, which, by the way, was like 20 something years ago. Okay. Of course you had issues trying to get a letter from the Costa Rican University to prove that I actually did go. I'm a practicing vascular surgeon in America for over 18 years. Of course, somebody at some point checked that box, but somehow these people's livelihood is about trying to check every box in your CV, and then they put you through all these dumb processes. So back to the question, when do you think that my app is going to help me, and how hard is that pull going to be, and how complicated is it going to be?
Much sooner than you think.
Okay.
And the reason I say that is, for example, the ECFMG solution. I forget the name of the organization. I don't remember. Starts with an I, but basically it's a new software system that actually just launched on January 10th.
Okay.
That's, the ECFMG and the FAMAR data with the ACGME and the AMA, and they're like basically streamlining and automating that whole process for people. So they say, it was launched on the 10th. I actually emailed them to kind of get some understanding of where they're at with that. But imagine a world where next time you have to go through that process, your medical school in Costa Rica can issue you a verifiable credential into your wallet, basically PDF attached to a decentralized identifier with the provenance data that it came from them. So when you share that ever again in the future, it's just as good as if they sent it. That's what we're building.
Of course.
Okay?
Yeah, I understand the concept. The question is, how long before how long and how difficult is it going to be to get there?
So the reason it's, first of all, it's difficult. I'm not going to say it's easy.
Yeah, of course.
But how long? It's very soon. Within the next few years, I believe these are going to be the new way of doing things. And the reason I say that is, in general, the ecosystem of verifying credentials and identity management for all industries, whether it's for trade or whether it's for undergrad, they're building longitudinal learner records. There are lots of companies out there, Credly, Credible, Verifiable, Smart Resume. There's another one out there, I forget. But long story short, these longitudinal learner records using these open standards, whether they're open badges or whether they're WC3 or Decentralized Identity Foundation open standards, they all are interoperable. There's an API for verifiable credentials that's available. So from a learner record standpoint, everything from your medical degree to your procedure logs to your final summative evaluation can be issued into a wallet very soon because it's being adopted as we speak. Now, on the other side of it, from a patient experience perspective, the 21st Century Cures Act was finalized in 2020. And when I was doing this kind of research thing in the very beginning that I discussed with you, one of the things I learned about was the 21st Century Cures Act, which was basically enforcing that patients need to have immediate usable access to their information, access to their data. And in that legislation, you can look it up on the federal website, it says doctors also need to have immediate interoperable access to all patient data. Now, in order for that to work, you need an identity system. And there are recently approved identity service providers. ID.me is on there. iChronos is on there. We're in the process of exploring, do we become one of these identity service providers, or do we integrate the application of those who have been accepted and approved? So when it comes to patient information and logging in to order things and logging in to get your patient's x-ray from when they were on vacation in Florida and now they're in your office and you want to see what, without having to reorder the thing and wait another week when the patient's, in pain. This is the tool that's being built. The standards were developed, or not the standards, but the regulation was finalized in 2020. And just last month, they finalized the actual technology standards. And, they're called QHINs. And they're basically going to be enforcing these standards and making sure that they're compliant. So Epic is one of them. Health Gorilla is another one. So all of these data aggregators of health data are going to need us to verify our identity in order to make it truly accessible and usable. And because the regulatory requirement requires that it's accessible to us, I believe a solution like ours is going to be the choice for independent doctors.
Is there anything that today I can do practically with the app? What can I do?
Yeah, right now you can log in, you get your identity verified, and then you're automatically entered into a group of other doctors in your state, other vascular surgeons in your specialty. And then you're able to directly connect and have secure communication with individual doctors. There's a social network, and there's a place to store your credentials where you can actually upload your medical degree, your ECFMG, put it in there. It's not a verifiable credential yet because it hasn't been issued, but you can share that via email with anybody you choose. And when those verifiable credentials are available, you can receive them. So that's all the plumbing for that is in place. You can also invite your colleagues. The governance stuff, we're still redeveloping and optimizing that. And that's it so far.
How about CMEs?
Yeah.
Are you allowing that to be?
Yeah, you can upload
for
CMEs, anything you want. You can upload a picture of, your butt into your credential wallet if you want to right now.
I think that would be a very hairy situation.
Yeah.
Just be careful if you ever try to share it, But yeah,
It'll
all
be
the
verified.
credentials.
No. Okay.
Yeah.
So if there are some, young and very interested people here in our audience that want to learn more, that want to hear more, what would be your advice to get a little bit more involved with HPEC? Join
us on the website. Importantly, because the website brings you into our CRM where you can get our newsletters, and then join the app. By the time this is published, we should have a new release out that has kind of fixed some of the account recovery stuff that's causing some friction for us. But yeah, join the app, join the newsletter. We're going to start having, calls again and meetings again. And if you are a residency program director, or you are a credential service provider, or you're a resident or a medical student who wants to get your medical degree into your wallet, let's talk. There's processes that I have in place where you can apply at your school to have us become a pilot partner. We have to do paid pilots because everything costs money. But, if you are in an innovative, forward-thinking place, there is opportunities for these kinds of things, and there's research opportunities that you can get capital for from your institution. And yeah, just be a part of it. Join.
Can a private practice like myself, as we are thinking of growing, can we use you as a credentialing system? Again, I get as a pilot. Does that make any sense for you to have a place where there's?
So this is what everybody's asking us, and we really don't want to become a credentialing company, because there's thousands of credentialing companies out there.
Okay. But
we do have the ability to make a very basic credentialing system. What we'd prefer to do is partner with people. Like, for example, tomorrow I have a call with CEO of Intiva, which is a free credentialing software. So I was going to say to him, hey, why don't you integrate these APIs and then have a version that you charge for and pay for the APIs? And then we can kind of do some cross promotion and work together, rather than us taking our very limited, $1 million sounds like a lot of money, but we only raised about $500,000 on the last round. When it comes to software development and business development in this space, it's not a lot of money. So we don't want to go doing stuff that we don't have to do. I'd really rather partner, and have the wallet be the solution for doctors, and have the credentialing solution providers integrate the APIs.
Well, I'm going to sign up, so you convinced me. I'm going to try to learn a little bit about it and go from there.
Are you thinking that at some point you'll turn it into a SaaS model? You think that you'll...
So the credential issuing system is a SaaS model.
Okay.
All right.
So you are paying a little bit of like a monthly fee or an annual fee or something like that?
It's not enterprise ready yet. We're, part of why we raised capital is because it was a very beta version. So we're trying to get that up and enterprise ready. We probably don't have the capital to make it fully implemented, which is, why we're really focused on optimizing the app. But I mean, this is a very nascent industry. It's kind of like, remember back in the day when you got your checks mailed back to you and that's the only way you knew that they were cashed?
Yes.
That's where we are with credentialing. And so we're the first company that's going to the first bank to say, hey, look at this thing where you can take a picture. And they're like, how does that secure? Our customers don't trust it. That's where we're at. It's very early.
Yeah. Well, I'm going to put one request as a potential investor, is that you do it clear, because I'll shoot my parts of my body off if I need to have more passwords that every month change, And now they require 32 different characters, backwards and upwards and downwards and lowers. And if you repeat anything that looks sort of kind of like the last 32 passwords you've had in 10 years, your system won't let you go in. I cannot believe that in this century, we're still dealing with passwords as a problem. We need
passwords
iris
are a thing
checks.
of the past.
We need an iris check, a digital something like really. I mean, you should just look into the camera of your computer and boom, you're in.
Yeah, my account locked me out. I had like 30 something patients to see this week in like 4 hours in clinic, and then my computer like wouldn't allow me into the system
because you screwed like some
I
password
screwed up
thing.
the log.
And then you got
oh my god, I had to call IT right there. Patients were mad at me.
And the one that I hate the most is the inactivity one. How about that one?
Oh yeah.
So I cover the pediatric hospital, Texas Children. You know, a vascular surgeon doesn't get called every day there. So sometimes 2 months will go by that we don't log in. And then we're logged out. And it's like literally getting God to give you privileges to come back into the world. So anyway.
Anyways, yeah.
Leah, I think you have
Passwords
tons
are
of...
a thing of the past.
Yes.
Well, tell these people, please.
Please fix this as you're fixing our life. Yeah. Hey, this has been great. I think a lot of people are going to find this very interesting, very intriguing. I hope really that through our efforts, we can get you a few more followers, a few more investors, a few more believers, as this tribe should be. This band of brothers and sisters should band. Really, that's what doctors, we've been sucky at it for a long time. We're letting other people tell us how to do and how to carry on our professions. And I agree, it's time to not storm the Capitol, but certainly do something very,
so much.
Oh my god,
very aggressive.
Canceled.
Don't storm the Capitol, but do something like,
Oh my god, let's cut that out.
No. It's stealth. It's a Trojan horse,
Yeah.
We're just doing credentialing. We're just making it easier to credential, but really we're building referral networks.
We got to step up.
I love it. We got I love the strategy.
Moana this shit. Anyway, Leah, thank you very much. You've been a very gracious guest, and I hope that you also share with your followers once this whole thing is all done and edited. And we'll put some filters on Lucas because he looks kind of sick today. He's going to have to go to his concierge doctor for some advice today later.
I'll call James. He'll fix me up. All right. Shout out to James.
Is there anything else, Leah, you'd like to wrap up? Otherwise, we'll let you go.
I think it's time. This is Hippocratic Oath 2.0. It's time for us to claw back what was taken, to eliminate the middlemen that are causing harm, and to really be able to serve our patients again. Doctors are leaving medicine. We don't have to leave. We can build a system that's better for us. We just have to work together to do it.
Love you. Thank you. Thank you for that.
Yeah.
All right, Leah, pura vida. Thank you very much. We'll be in touch. Bye-bye.